So we spoke, it was about 2 years ago, this past June, I think. You had presented on this topic of pug dog encephalitis and gave a hint of some work that you were doing back then.
Yeah.
Many times we hear about clinical trials and, the very early stages of investigating a treatment, and a lot of those fall apart for whatever
Yeah.
reason, either due to safety or efficacy or what have you.
Mhm.
But I know that you have some exciting updates for us, and I'm hoping that you can talk to us about it. This
Yeah.
horrible disease, as you mentioned to us a couple of years ago, just, the severe inflammation and destruction in these brains that lead to seizures and other problems. And you did a wonderful job introducing us to this disease and what was happening. And at the time, I think you were doing some clinical trials. So I think we're at a stage now of kind of talking about where we've
Yeah.
come, right?
Yeah. No, super exciting. Yeah. Yeah. So just to recap, like you mentioned, this disease is horrible. I mean, it is, it's like current normal form, 100% fatal. And pugs are the most common breed we see it in. We do see it in some other breeds, but the nice thing about having a specific breed that it's most common in is that we can try to backtrack and say, are we missing something? Are we missing an early stage of this in this particular breed with a known genetic risk that we could start screening for so that they don't get to that stage, where they have this horrible, fatal necrosis. And what's so interesting about it is that when you look at the genetics, definitely the progression and the symptoms in that severe form, really similar to an aggressive type of multiple sclerosis in humans. But again, I think we've been kind of narrow-minded in thinking that this is a disease that comes on quickly, progresses quickly, and then they die from it. Whereas we've kind of now realized that there's probably a more chronic form to this that we're just not seeing because the symptoms are more subtle in the beginning stages. And when you start looking for those symptoms, which is kind of the work we've done over the last few years now, see, do we have anything in these early stages? What's crazy is that the earliest signs that we're seeing of this disease are the same as the earliest signs of MS as well. And so in humans, they're finding, the sooner you could start treating people, the better. And they do similar stuff to us. I mean, they're using immunosuppressive steroids for a lot of these inflammatory conditions in the brain, but have the same struggles, right? They're not curative. They have a lot of side effects. And so what can we do to try to actually modify the disease process instead of just trying to treat the symptoms and reduce the inflammation? And so they're certainly looking at stem cell therapy in humans with MS as well. The biggest challenge is that the disease course is long, so you're talking, and a lot of people, 30 to 40 years maybe for natural progression of disease. And stem cell therapy has probably been employed over the last 10 to 15 years, right? So you don't have a lot of time to kind of see what's, going to happen because it takes a long time to follow those people. So what we'll find in looking at the human MS studies is that they'll have short-term follow-up. How do they tolerate it? Do they have any immediate effects? But they don't really have a lot of good long-term data. And so what we've looked for in these pugs is one to see, can we find an early phenotype of this disease, which we think we have, and then look and say, if we start treating these guys with stem cells early, can we keep them from developing this aggressive form? And then also what happens after that, right? After that immediate short-term phase, how do they do long-term? And so we just had our pilot study. We had 13 pugs that we found over the course of the last 4 years that had these early indications of NME, both clinical signs, also MRI findings, CSF findings consistent, with early signs of that disease. And so we treated those guys with stem cells in that early phase. And we just got this paper published in JAVMA this summer. And it was honestly pretty amazing what we were able to see. And so for me as a neurologist, like dealing with all of these inflammatory cases all the time, you get really frustrated, feel really hopeless a lot of the time. And so I think probably one of the most amazing things to see was just how quickly they responded. And so we had dogs where we were tracking them over the course of 2 to 3 months, and we just saw them going down, 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 down. And within 24 hours of the stem cells, I mean, the majority of them were back to normal, or if not dramatically better. It was unlike anything I've ever seen, and a lot of dogs that was sustainable. So sometimes it was variable, like they'd have relapses at different phases, never to the, like as severe as they were when they started. But sometimes they stayed in complete remission. Some were as far out as like 16 months, they'd show some signs of relapse and usually would respond again, to the stem cells when given again. And so this is obviously a pilot study, so we have to take it for what it is, right? We didn't have a control group, which I don't think I ethically could. You know what I mean? You find this group of dogs and we're like, oh, let's do nothing and just see what happens. You know what I mean? It feels horrible to think of doing that. But at least in this group that we had, being able to kind of appreciate like what sort of immediate effects do stem cells have? How long lasting are they? We're now the minimum follow-up of 1.5 years. We're about 3 to 4 years out for some of these guys that are still in, complete remission. So we had over half of them in remission just with stem cells. A little less than half had other drugs added in, but much lower doses than you would normally need to use, and are all still in remission. So really pretty incredible for a disease that's typically going to be fatal within 6 to 9 months, if it progresses to its more advanced form. And so I think, again, pilot study, we have to take from it what it is, but it just showed us a couple important things. One, we can use this, right? It was safe. We didn't have any significant side effects. Also showed that given IV, it seems to be very effective. And so that's one big question that we always have, because we obviously have the blood-brain barrier separating the nervous system from the systemic, bloodstream is, are we going to get drugs that are going to penetrate in there while given IV? Because the alternative, and they do this a lot in people, is to give it intrathecally, so kind of inject it into the cisternum, cisternal space or lumbar space, or even inject it directly into the brain, to try to get better penetration. And kind of seen that those methods seem to all work, but you can imagine logistically how difficult it is to try to inject stem cells, even into the CSF space for most people practically, much less into the brain. And so to be able to show like, hey, IV stem cell therapy is effective, and I think part of the reason for that is, one, just the ability of stem cells to be able to penetrate into the brain. But a lot of it is understanding, again, going back to this kind of systemic immune dysregulation, is that autoimmune diseases in the brain are rooted in systemic inflammation. So it's not a situation where it starts there and it lives there. It's usually starting systemically and getting to the brain and triggering these inflammatory reactions there. And then they just feed on each other. So it's, gets triggered in the brain, and the brain just continues to call, more inflammatory, mediators and cells into the brain, and it just propagates itself. And so if you can try to address it at a systemic level, it helps just as much as trying to do it locally. So really, really learned a lot from that, as far as like what potential do we have now to extrapolate this, not only to considering using it as a model for MS in humans, but also just to more broadly apply it to other inflammatory diseases. Because the downside with this disease is it's not that common, so to try to go through the efforts of doing all the screening and finding the patients, it takes a long time. So over 4 years, we got 13 dogs, right? And so versus the other form of kind of category of immune disease in the brain would be GME, or granulomatous meningoencephalitis, and that's much more common, so it just kind of allows us to know, like, hey, it worked for this, could it work, for other inflammatory diseases too. So super, super exciting. And numbers aside, for me, the most exciting thing has just been the pugs and like their families, and just seeing, we got their lives back, and just so rewarding. And I've now watched them grow. I feel like they're my pets too. I've watched them grow over the course of the last 4 to 5 years, and to see them go from, young dogs to now like middle-aged dogs and really happy and healthy, is just like, rewarding is just too small of a word, I feel like, honestly, to put for it. So
yeah, I can imagine. And you say it's not that common. I think your initial talk, we had taken an excerpt and put it on YouTube, and it's had like lots and lots of views. So clearly it may not be a very common disease, but if you're impacted by it, then it's very important to you. So
of course, yep, yes, and definitely just to have the pug community be very well aware of the importance of these early screening techniques and treating early. And it's interesting now, the number of veterinarians that will reach out to me that have, read publications or heard about things or seen talks and just get my advice as to what to do. And even if they're not at a place now where they can use stem cells commercially, which I think we're going to get there, Sherry, we'll get there someday, but not hopefully too long. But for now, at least they can say, hey, this is not a dog that I would have normally treated before, but based on what you wrote, could this be an early case? And I'm like 100%. And that's part of the problem, is that they're so used to looking for this fulminant form that they don't think like, hey, if I've got a 1-year-old pug, you know what I mean, that is got some seizures and has a mildly inflammatory CSF, could that pug be an early NME case? 100% it could be, and so don't wait to treat it until it's fulminant and then dies, and so that's, I think, been really rewarding too, is pug, parents becoming their own advocates, vets being more aware, so that we can go into kind of these early treatment programs, regardless of whether it's with stem cells or not.
Well, that's a great update and very cool.